Hi students, today we will see about chronic obstructive pulmonary disease. Definition of COPD. It is a chronic inflammatory lung disease which causes the obstructed airflow from the lungs. So, it is mainly characterized by progressive and irreversible airflow limitation. It leads to the breathing difficulties and other respiratory symptoms. Here, the COPD is a chronic lung disease. What it causes? It causes the normal airflow obstruction from the lungs. It causes the airway obstruction. It also describes a group of lung diseases such as chronic bronchitis, emphysema, and respiratory asthma. In this COPD, we can observe all these conditions. Here, if we observe for the normal air exchange will be taken place in this alveoli. Whereas in COPD, here what happens? The sticky mucus in the bronchioles, it blocks the airways. It causes the inflammation. In case of chronic bronchitis and emphysema, what happens? The damage to the air sacs will be taken place. So it causes the difficulty it makes the difficulty in the gases exchange. So it leads to COPD. The main causes of COPD involves cigarette smoking, air pollution, occupational dust and chemicals, genetic factors. Due to all these conditions, the airflow obstruction may takes place due to the thickening of the mucus or any alveolar damage, or the impairment of gaseous exchange will be taken place. So ultimately it leads to chronic obstructive pulmonary disease. Causes of COPD. Mainly we can identify these risk factors such as occupational dust or exposure to the dust, any chemical exposure in the factories and industries due to the fumes, air pollutions, and due to the genetic predisposition. These are all the main causes that ultimately leads to COPD. Pathophysiology of COPD. In case of different conditions, how it varies, we can see in this. In case of chronic bronchitis, here what happens? The inflammation and narrowing of the airway will be taken place. So, it leads to the mucus production and cough. This causes the obstruction of the airways. If the mucus production formed, the obstruction of the airway takes place. So, the client may are difficult to breathe. In case of emphysema, the damage to the air sacs in the lungs, the alveoli damage will be seen. So it reduces the surface area available for the gases exchange. Whatever the amount required for the gases exchange, the surface area will get reduced. So it leads to the shortness of breath and difficulty in the breathing. It further causes the reducing the lung capacity. Elasticity of the lungs will get reduced. And oxidative stress of inflammation. If the damage caused by the any noxious particles and the gases, it occurs in imbalance between the free radicals and antioxidants in the body. So it leads to the damage to the cells and the tissues. So due to the oxidative stress and all, in case of the body response, the inflammation will takes place. Here, due to the exposure to smoke like particles, chemicals or reactive oxygen species, the inflammation will take place. Here what happens due to the inflammation response and all, the activation of neutrophils will takes place. But here the anti-proteases inactivation will get soon and the chronic inflammation will be seen. In case of hereditary deficiency in alpha-1 antitrypsin also, the elastic capacity will be increased. So, the ultimate follow will be tissue destruction. The ultimate result will be the tissue destruction. A chronic inflammation and the tissue destructions will take place finally. Main clinical manifestations of COPD. Most commonly, we can observe the clients with the COPD, chronic cough, sputum production and the shortness of breath, and wheezing, chest tightness and fatigue. These are all the clinical manifestations we can observe if the patient is affected with COPD. Next, we will see about the diagnostic findings of COPD. Mainly, it involves the clinical history, physical examination, pulmonary function test, spirometry, and the lung volume measurements. In case of clinical history, it mainly includes questions about the patient's smoking history, how many they are taking per day, and what is the severity of that cigarettes intake, and all we need to observe. Occupational exposure to any lung irritants and any respiratory symptoms such as the cough, sputum production and dyspnea, how frequently they are getting the sputum, how severe the cough, like that we need to observe the symptoms. Then second one, physical examination. It includes the evaluation of the respiratory test, chest wall symmetry, use of accessory muscles while taking the breath, and presence of any wheezing or crackles. These all need to be identified. In case of pulmonary tests, it is mainly essential in the diagnosis of COPD. The two pulmonary function tests are spirometry and the lung volume measurements. In case of spirometry, here the forced expiratory volume in 1 second and forced vital capacity we need to identify. Here, the forced expiratory volume 1 and forced vital capacity ratio helps us to identify the diagnosing COPD. If whether the person is affected with COPD or not, we can easily observe in this condition. Then lung volume measurements. It helps us to assess the severity of COPD. The mainly two lung volume measurements include the total lung capacity and the residual volume. Here, how much they are frequently getting the attacks and how much the airflow, this all helps to identify in the total lung capacity and residual volume measurements. Next, we will see about the management of COPD like medical, surgical and nursing management. The medical management mainly involves in the airflow limitation, which causes the airflow limitation and breathing difficulties. We need to observe further and according to that we need to treat. The main things which we can use in this COPD are bronchodilators, corticosteroids, phosphodiesterase 4 inhibitors, antibiotics and the oxygen therapy. Whereas coming to the bronchodilators, it helps to relax the muscles which are surrounded in the airways. Thus, it helps to open up and improve the airflow. It is the first line therapy in case of COPD. The short acting bronchodilators and the long acting bronchodilators. In case of short acting, it helps to relieve the quick relief of symptoms, whereas in the long acting, it helps in maintenance therapy. Next, corticosteroids. Corticosteroids, these are the anti-inflammatory medications. Can be used in case of in the combination with the bronchodilators also. These are available in different forms such as inhalation, orally or IV form. Through intravenous forms also they can use. Next one, phosphodiesterase 4 inhibitors. It helps to reduce the inflammation in the lungs and improve the lung function. So in case of severe COPD and all, these PDE4 inhibitors can be available in the oral forms also. Antibiotics. If the person is affected with COPD due to any bacterial infections, the person may need to get these antibiotics. These both are available in oral and the intravenous forms. Next, oxygen therapy. It helps to improve the oxygen levels in the blood for the patients who are having the who are affected with COPD and the person with the low oxygen levels. The oxygen may be administered through the nasal bronchs, mask or the ventilator. It helps to reduce the further risk of hospitalization and the death. Surgical management of COPD. If the patient is not getting treated by using the medications, next step the patient may undergo for surgery. The main surgical options for COPD includes bullectomy, lung volume reduction surgery and the lung transplantation. In case of bullectomy, here what happens, the removing the large air spaces we can call it as bullet. Due to in case of emphysema, the large air spaces will be formed in the lungs. So, along with the lung volume reduction surgery, the bullectomy may be performed. Next, second one, lung volume reduction surgery. Here, it involves the removal of damaged lung tissue. So, whatever the lung tissue which is working effectively, we will keep that thing and whatever damaged lung tissue is there, we will be removed by using the open surgery or the video assisted thoracoscopic surgery. Final one, lung transplantation. This is the last option for the COPD. If the further treatments are failed by using medical management or lung volume reduction surgery in case of chronic condition and all, we need to go for lung transplantation, but it involves more risk. Nursing management of COPD. Mainly it involves the pharmacological management and the patient education. In case of pharmacological management, the first initial measures are administering the bronchodilators and monitor for any adverse reactions, such as if the client is getting any corticosteroids and if the person is affected with the hyperglycemia and immunosuppression, or if the client is getting affected with the respiratory infections and all, we need to administer the bronchodilators and the antibiotics based on the physician prescription. In case of patient education, it mainly plays an important role whether it involves how the patient is using the inhalers and nebulizer, they are using correctly or not. We need to identify and educate the patients regarding the smoking cessation. If the patient is exposed to smoking and all, we need to identify the risk factors and we need to educate the infections. The client physical activity must be observed and pulmonary rehabilitation must be improved so further complications will be prevented. We'll see about the pulmonary rehabilitation. It is a comprehensive program, means mainly it involves training, breathing techniques and patient education. In the pulmonary rehabilitation programs and all, we need to monitor the patient's progress and we need to give the guidance according to the patient's condition. Oxygen therapy. In this condition, we need to maintain and monitor the oxygen saturation levels and the oxygen flow rate must be adjusted according to the condition, whether they are maintaining the oxygen saturation levels in normal rate or further decrease in the oxygen saturation takes place, means we need to monitor that condition by observing through the pulse oximetry, and we need to adjust the oxygen flow rate. Finally, we need to educate the patients about the proper use and care of the oxygen delivery systems. So, in this today's topic, we had completely covered about the definition of COPD, etiology, risk factors, pathophysiology, diagnostic findings, and the management of COPD. Thank you, one and all.